The digestive system consists of your main digestive tube, what we sometimes call the gastrointestinal tract, or GI tract, or alimentary canal, that tubular passage that your food will pass through, going through your digestive system. And it also consists of some other structures that grow out from your digestive system we will identify here in a minute. To just identify and sequence those elements of your primary alimentary canal, we begin with the mouth. Behind the mouth is the pharynx, and we'll identify regions of the pharynx later on. The esophagus connects the pharynx to the esophagus, the pharynx to the stomach. The stomach leads into the small intestine. The small intestine is divided into 3 regions we'll talk about later. And then the small intestine empties into the large intestine, the last segment of your digestive tube. Associated with the mouth, you also have some outgrowths, your salivary glands. So we will look briefly at the salivary glands, and then an outgrowth from the small intestine becomes actually 4 different parts, but 2 parts are pancreas. It includes outgrowths that develop into the liver, the gallbladder, and the pancreas. So we will study those also when we study the rest of the digestive system, since they're derived from it. The nasal passages and sinuses are associated with the early development of the mouth and separate from it by the development of the palate that divides the two during early development. And your lower respiratory system, your larynx, trachea, bronchi, and lungs also grow out from your digestive tube early on in development, but we'll cover those with the respiratory system. This illustration in your textbook gives a good example of the oral cavity. The primary features to notice here, in the back of the mouth there's an opening indicated by these arrows. It's referred to as the fauces, the opening between the oral cavity and the oral pharynx. So it's that passageway between the oral cavity and the pharynx. Hanging down right in the middle of that opening, you have the uvula, and off to the side of the uvula, on either side over here, you have what we call palatoglossal arches. On the roof of the mouth, the front part of the roof of the mouth is backed by bone, and we saw that when we studied the skeleton. That front section of the palate is all backed by bone. The back part of the palate, back in here, is not supported by bone. It's only soft tissue. We refer to that as the soft palate. So we have a hard palate and we have a soft palate on the roof of the mouth. The gingivae, those are the gums. They cover the tooth sockets and help to anchor the teeth. The tongue, of course, in the floor of the mouth, and there's a connecting strand of tissue beneath the tongue that attaches the tongue to the floor of the mouth, called the lingual frenulum. The lingual frenulum. The space between the gum and the lip, or the gum and the cheek space out over here, is called the oral vestibule. The oral vestibule. Linking the lip to the gum line right in the very center of your incisors, both on the lower lip and the upper lip, are labial frenula. So there's an inferior labial frenulum here, a superior labial frenulum up here. You can feel those with your tongue. If you pull your lip out a little bit, you feel that tight, sharp edge of the frenulum, superior and inferior labial frenulum. Labial refers to lip. It's an alternative name for lip, so you have the superior lip or labium up here and inferior lip or labium down below. There are two openings to some of your salivary ducts shown in this picture right at the base of the lingual frenulum. Those are the openings to the submandibular ducts. The teeth are all shown here. The incisors, there's 4 incisors below and 4 above. Next would be the canine. Then there are 2 premolars and 3 molars, the same pattern above as below. Now here is a view of the salivary glands in your textbook. It shows the primary major salivary glands, the first one being the parotid gland that sits here kind of in front of and below the ear, covering the side of the jaw angle over here. There's a single duct that extends from that called the, well, we can call it the parotid duct, or it's also known as Stinson's duct, parotid duct or Stinson's duct, and it enters into the oral cavity to the outside of your second molar in the oral vestibule. Next, the submandibular gland is located just inside the angle of the jaw, inside the mandible there. There's one on either side, the left and the right. Each of those has a single duct that leads up, and we've already seen that in the floor of the mouth at the base of the lingual frenulum where that duct enters into the oral cavity. It's indicated here in this picture. It is also known as Wharton's duct, the submandibular duct. The third major salivary gland type is the sublingual gland, seen right in here. The sublingual gland has several smaller ducts that come up to the floor of the mouth underneath the tongue. In addition to these 3 major salivary glands, the parotid, the submandibular, and the sublingual, there are many minor salivary glands, tiny glands that are somewhat like the way you have sweat glands and oil glands in your skin. They line the oral cavity in most regions. So you'll find them in the lips, the cheeks, the gum, the palate, the tongue. They all have minor salivary glands that secrete salivary fluids into the oral cavity. The saliva has the function of moistening the food so that it's easier to swallow. It also adds water to the components in your food so that it can be better digested. To break apart your chemical bonds, you have to add a water molecule to divide the chemical structures. So water is essential in the chemical breakdown of food molecules, as well as just moistening the food to make it easier to swallow. Salivary enzymes that are produced by the salivary glands help to digest primarily starches. So some of your starches begin to break down chemically through the action of your saliva. So your mouth is involved in chewing, of course, and manipulating your food to make it into something you can swallow. So it has a mechanical digestive function, but also that chemical digestive function where it begins to break down some of your carbohydrates. And to finish the material having to do with the oral cavity that we're dealing with, a look at the tooth. So we're going to talk about the tooth for a minute. This illustration in your textbook shows the tooth has a region we call the crown and a region we call the root, and in between we have a region that's referred to as the neck. Now the crown here is shown as the portion that's above the gum line. So here's our gum line right here. So the part above is the crown. Sometimes we define what's called a clinical crown, which is that part that we see here above the gum line. And sometimes we talk about a clinical crown or an anatomical crown, where the area that's covered with enamel makes up the crown, which would include what's shown as the neck here. So our enamel goes down to here, but it doesn't come above the gum line until here. So our enamel does not cover our entire tooth. The layer beneath the enamel is the dentin layer. The dentin layer extends down deeper forming most of the root of the tooth on the outside. The third layer in is the tooth pulp. That tooth pulp has both blood vessels and nerves, as well as a lot of connective tissue that extend up into it. The blood vessels and nerves come from nerves below the tooth through what's called an apical foramen at the base of the tooth here. So it comes into the pulp in this region here. So we've got the pulp, then the dentin, and then on the surface we have the enamel. Down in the tooth socket, where we don't have enamel covering the tooth, from the pulp we go to the dentin. The next layer out is called cementum, a slightly different composition of material than what we have in the dentin, is the cementum. Beyond the cementum, there's a connective tissue layer called the periodontal ligament that holds that tooth to the bone. So here's the bone tissue, here's the periodontal ligament, and then there's that thin layer of cementum, and then the dentin layer underneath of that.